All right, let's get right into it. Welcome to today's Explainer, where we are going to unlock the secret language of massage therapy. Have you ever walked out of an expensive session feeling like, well, it just completely missed the mark? Maybe you were too polite to say anything, or you honestly just didn't know what to say? Well, today we're changing that. We're focusing exactly on how you can guide massage pressure, shifting your whole experience from just basic relaxation to high-level clinical recovery. By the end of this, you're going to know exactly how to dial in that pressure so you get a perfect, totally bespoke experience every single time. Okay, let's really dive into this because there's a huge frustration so many of us have felt, and it really boils down to one simple truth. Stop wasting money on massages that are either too light to work or so painful you can't breathe. If you've ever been on a massage table literally just gritting your teeth, or on the flip side, wondering if they're even touching you at all, you know exactly what this means. It's incredibly frustrating to invest your time and your hard-earned money only to realize you're stuck in one of these very uncomfortable extremes. To fix this, here's our game plan for today's structured journey. First, the pain point paradox. Second, the cost of vague feedback. Third, targeted not release techniques. Fourth, verbalizing specific tissue needs. And finally, finding the perfect sweet spot. We are going to transform you from a passive recipient into an active collaborator. Let's kick things off with Section 1, the pain point paradox, bridging the gap. So why is it that so many people just can't find that ideal balance between blissful relaxation and actual effective physical recovery? Well, clients constantly find themselves bouncing between two total extremes. You've got pressure that's way too light, offering zero relief, right? Versus pressure that is so painful you literally can't catch your breath. The source material tells us exactly why this happens. It's because most people struggle to bridge this gap simply because they lack the right vocabulary. Without the words to translate your vague requests into a precise pressure scale, you're just left stranded in this paradox, never quite getting the custom experience you actually went in for. Moving right along to Section 2, the cost of vague feedback. Why guesswork fails. Failing to bridge that communication gap doesn't just result in a mediocre afternoon. It actively sets you up for failure. We use certain phrases all the time without realizing they are actually subjective traps. Telling your therapist to go, a little harder, or asking for medium pressure. It feels like you're giving clear directions, right? But what's really interesting here is the data shows these are purely subjective. I mean, think about it. What medium feels like to a 200-pound pro athlete is vastly different from medium to someone else. These vague phrases are exactly what lead to disappointing sessions, and let's be honest, wasted money. And this reveals the fascinating psychology behind the therapist-client gap. Think about how absurd the situation is when you break it down. You're lying there, face down, staring at the floor through that little donut-shaped headrest, completely silent, while a trained professional is basically forced to guess your physical needs. Your provider is making assumption after assumption based purely on your silence. And listen, guesswork simply does not belong in clinical recovery. So what this means is we need a massive mindset shift. We absolutely have to stop being the passive recipient, the person relying on silence and hoping for the best. Instead, we need to become an active collaborator. When you shift your mindset to actively collaborating with your provider, that's when you unlock true clinical recovery. You are literally taking control of your session, making sure the professional knows exactly what your body needs in real time. It's a real game changer. All right, Section 3, targeted not release techniques. Going deeper. Now that we've got the right collaborator mindset locked in, we need to understand the actual methods the pros use. We want to aim for what the sources call the clinical results style. This is defined as mastering physical feedback and using exact scales to target deep tissue knots, and this is key without crossing the pain threshold. So the crucial point here is that you do not have to endure breath-stopping pain to get high-level clinical results. No way. By using specific terminology and exact scales to guide the massage pressure, professionals can make sure every single session hits that perfect sweet spot for recovery. To actually speak this language, you kind of need to know what therapies focus on releasing those stubborn knots. The sources highlight 3 core therapies, and they each feel pretty different. First, myofascial release. That's all about slowly stretching out the tight connective tissue covering your muscles. Then there's trigger point therapy, which is highly localized. Think of the therapist pinpointing the absolute core of a specific knot and just holding pressure right there. And finally, neuromuscular therapy, which focuses on balancing the central nervous system and the muscle itself. When you act as an active collaborator, knowing these specific techniques lets you ask for exactly what you need, rather than just crossing your fingers and hoping the therapist's guess is right. That brings us to Section 4, verbalizing specific tissue needs, the insider playbook. So how do we actually take all this and talk to the therapist? Well, there is a massive difference between surface-level circulatory work and targeted myofascial release for chronic knots. Look, if you just want the skin rubbed to improve blood flow, surface level is totally fine. But if you want to treat deep-rooted chronic tension, you absolutely must specifically verbalize that you need targeted myofascial release or deep tissue work. And this brilliantly illustrates why vague terms just don't cut it. Let's walk through this super straightforward 3-step communication framework. Step 1, like we just talked about, is shifting to that collaborator mindset. Step 2 is incredibly important. Use anatomical landmarks instead of vague regions. Don't just say, my back hurts. Point directly to your shoulder blade or the base of your neck. Guide the therapist to the exact origin of your tension, using those specific landmarks so they know exactly where to focus. And then step 3, communicate your exact tissue needs. Literally tell them what you're feeling beneath the surface as they adjust their pressure. Now, as part of communicating those tissue needs, you have to continuously perform this absolutely critical safety check. You need to confidently communicate the difference between a good hurt, that deeply relieving pressure as a knot breaks down, and a sharp, nerve-like pain. Sharp, nerve-like pain indicates a real risk. You must immediately verbalize if you feel that sharp pain so the therapist can back off or adjust their technique. Seriously, never, ever stay silent through nerve pain. Which leads us nicely into section 5, finding the perfect sweet spot, your custom experience. By combining that new mindset with the right vocabulary, you guarantee a bespoke, highly effective session. Let's move to and see how this builds, because this powerful quote from the sources really hits the nail on the head. There is a secret language between you and your massage therapist that determines whether you walk out healed or just sore. The reality is, most clients just don't know how to communicate their preferences effectively, and that just leads to missed knots and wasted time. But by utilizing the communication framework we just mapped out, you are now speaking that secret language. So, I want to leave you with this final thought and question. Next time you are on the table, will you be a passive recipient and stay silent, just hoping they guess right? Or will you step up, be an active collaborator, and speak the secret language to get the true clinical recovery you deserve? The power to guide your pressure and completely perfect your experience is quite literally in your words. Thank you so much for hanging out with me for this explainer. Now go out there and get the exact massage you need.